Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and good afternoon, everyone. Before I hand it over to Dr. Strang, I want to pass on my condolences to the families of the loved one who passed away at Northwood yesterday. We want to ensure that you know that we have our arms wrapped around you and want to support you. This is a difficult time to lose a loved one, particularly with all of the restrictions that we have around public health. But please know that we are doing all we can with our partners to continue to support you. I also want to say to those families who continue to have people living in Northwood that our partners at the Nova Scotia Health Authority, the government, are working very hard to ensure that we isolate this virus to continue to begin to make sure that we turn that facility back to some level of normal life. We can have a growing number of residents who had COVID-19 who now have gone through the 14 days isolation that we moved out in the hotel, and we'll continue to do that to make sure that we provide support around those residents who still live at Northwood. Dr. Strang.
Premier, thank you. Good afternoon, everybody. Yes, unfortunately, I do have to share that today we had one more resident at Northwood who passed away due to COVID-19, and my condolences as well to that family. In total, we now have 28 Nova Scotians who have died from COVID-19, and each of those, we talk about them as numbers, but each of them are individuals who have families, and we have to remember that. My condolences to each and every one of those 28 individuals and families. We have 20 new cases of COVID-19 today, which brings our total number to 935. But as we talked about yesterday, over half of those of that total number of cases can be considered to have been recovered, which is really good news. 529, in fact. We continue to have 11 people in hospital, 3 of those in intensive care. And as of today, we've had 27,486 Nova Scotians who have been tested and have the good news of having a negative test. We have 10 licensed long-term care facilities and unlicensed seniors facilities who have had at least one case of COVID in a staff or a member or a resident, and we've had a total of 227 residents and 97 staff affected in those facilities. Yesterday, the QE2 processed 905 tests, or testing numbers were up again yesterday. And to me, I take that as good news. We can't make firm judgments based on any one day, but the fact our testing volume was up again yesterday, and we have a relatively low number of positive cases, and the majority of those cases are associated with the Northwood outbreak, to me is a further indication that we are beginning to see a slowing down of COVID-19 in Nova Scotia, which is very good news. I also want to take a chance to recognize individuals at the lab. This week is Medical Lab Professionals Week, and I really want to acknowledge all the medical lab professionals at the QE2 Microbiology Lab for their extreme professionalism and dedication and very hard work that has allowed us to have the extensive lab capacity and testing capacity in Nova Scotia, and we lead the country in that. So happy Medical Lab Professionals Week to all my laboratory colleagues. And on that, I do want to encourage any Nova Scotians. We have lots of lab capacity. If you have concerns at all that you might have COVID and the symptoms we're looking for are fever, new or worsening cough, sore throat, runny nose, or headache, if you have 2 or more of those, if you have online access, do the 811 online screening tool. If you don't, you can call 811 directly, and through either of those, you'll get more direction, further assessment, and direction to be tested if necessary. I would encourage everybody, don't wait. If you feel you have those symptoms, do the assessment. The sooner, if you do have COVID, the sooner we test you and recognize it, the less the ability that it can be spread around. So we need to not be a afraid of not being able to get in for testing. We have lots of capacity, and as I said yesterday, we're looking at other ways to use that additional lab capacity to do testing in different ways to further track COVID-19 in Nova Scotia. I want to give a bit more of a detailed update on where we are at our long-term care facilities, building on what the Premier said. I'll start with Northwood. It certainly has been a considerable challenge for everyone involved, for the residents, their families, the staff, and the administration at Northwood. But this is a fairly unique situation, given it is by far the largest long-term care facility we have in Nova Scotia. It's the largest facility east of Montreal. So those sheer numbers present unique challenges in terms of the residents and the varying levels of care needs that they have at that facility. Also, with the large numbers of staff, mean we have staff coming to work in this facility from a number of communities throughout HRM and even beyond, and that increases, frankly, the opportunity for COVID activity in any one community to then be unfortunately brought in, unknowingly brought into Northwood. So Northwood has had some unique challenges, and as the Premier said, the situation, while it remains serious, is become very much under control. It is certainly stabilized. We now have 10 residents who can be have been able to be deemed as recovered, who've been moved to the hotel, and my understanding is a significant number more in the coming few days. We'll be able to do that. While we unfortunately have had 22 people in that facility die, we have to recognize that we've had 211 residents who have tested positive. The vast majority of them, with good care, have been able to recover or are recovering, and their illness has been able to be managed. By moving, continue to move recovered residents out from Northwood into the temporary facility, that is giving increasing flexibility for Northwood, and a key priority of theirs, and they'll be able to do this to the large extent already, is to make sure that as we do more testing, which is pretty well done, but as we do more testing, anybody who's positive, bring them into units where their close contacts on that unit are also people who have tested positive. As I said, we've finished the initial sweep of testing. There will be ongoing sporadic testing of residents who are negative, because we know that over time they may turn positive, as well as continuing to periodically test staff. So that this is a challenging, difficult situation, but with the support of the rest of the health system, we've been able to stabilize this, and it's now on a good path forward. Still lots of hard work to be done, and it will take a number of weeks before we can say we're actually completely out of the woods and declare the outbreak officially over. But I do want to thank first all the Northwood staff, the administration, first and foremost, but also their colleagues from the rest of the health system, the Nova Scotia Health Authority, IWK, VON, EHS. We have other facilities have stepped up. The unions have been right at the table. We've had volunteers and from Dalhousie, medical students, home support providers, and even volunteers from the community. And I know from their restaurants and other groups of the business community have stepped up in providing meals and other support. So I want to thank everybody who's from the health system and beyond who's come to the table and willing to work in a committed way and collaboratively to support Northwood. But we do have to recognize we have 9 other long-term care facilities or seniors' homes which have had at least a case of COVID-19. It's good. I reviewed all those this morning with colleagues. All of those facilities, we've had no new cases of COVID in staff or residents. So all the rest of our facilities who have had outbreaks, the outbreaks are stabilized. We don't have ongoing cases, and in many cases, before we can officially declare the outbreak over, we have to have a period of 2 incubation periods, which for COVID is 28 days. So these facilities, there's no ongoing disease activity, but we just haven't reached that 28-day period to be able to declare the outbreak over. And I think that's in the recognition of those facilities who, in a combination of good planning and foresight, as well as coordinated and collaborative responses from within the facility and with support from the rest of the health facility, we've been able to manage those outbreaks effectively, like we have been able to do in Northwood. So it's a testament to the preparedness and the commitment of our continuing care and long-term care sector, and I thank them for that. I'm going to end by emphasizing that as we talk about long-term care facilities, ultimately all Nova Scotians have a role to play in protecting those most vulnerable citizens in our long-term care facilities and other group settings like residential care facilities, homes of adults with disabilities. All of those are more vulnerable, and as Nova Scotians, the best thing we can do to protect them is to minimize the spread of COVID-19 in our communities, which then minimizes the chance of the virus being brought into one of these group living facilities. So the more we can keep COVID-19 at a low level and eventually eliminate it in our communities, the less chance there is of any infection moving into these higher risk environments. So even as we start to look at how we might slowly and carefully reopen society and reopen our economy, it's important to know that we'll all need to continue to maintain the social distancing, being in groups of 5 or less only where essential, things like good hand washing. Those are going to be very important for the long time, for weeks and months to come, and it's critically important that we all stick with those. And together we will manage this, and together we'll be able to get out of this with the minimum impact on those most vulnerable in our communities.
Thank you, Dr. Strang. And now we'll take any questions. Tina?
Again, just a reminder, we'll take one question, one follow-up from reporters on the phone in the allotted time that we have. We'll start with Alicia Drouse from Global. Go ahead, Alicia.
Hi, you've spoken a lot about Northwood being stabilized. I'm just wondering what that means and how we know they're stabilized.
So it means from several perspectives that they were challenged first and foremost where they ran into significant challenges with staffing because they had a lot of staff off sick, the extra care needs of residents, and a number of other factors. With all the support from that I mentioned, all the other parts of the health system, we've very much been able to stabilize their staffing. So they have the appropriate staffing levels that they need. We've also been able to bring in higher levels of care to support the many individuals with COVID-19 and allow them to be treated within that facility. We have gone in through with enhanced testing, so we know pretty much the status of everybody in that facility. The ones who are negative, whether the residents or staff, will continue to test periodically, but we have a much better handle on where throughout the whole facility on who has or doesn't have COVID-19. The other piece that's very helpful here is that many of the staff who were put off work when they were tested positive, it's now 2 weeks and they're well and they're able to come back to work. So a number of factors at play, both on the clinical supports, the staffing supports, and as I said earlier, getting people who've recovered out of the facility, allowing greater flexibility to move people within the facility. So all those contribute to a very, while it's still challenging and a lot of work that needs to be done every day, it's a very stable environment. There's a plan forward, and people are working very hard in a collaborative way to keep it that way.
Alicia, do you have a follow-up?
Yes, I do. I'm just wondering what lessons we've learned from the outbreak at Northwood and maybe if anything should be done differently in the event of a possible second wave.
So I think that Northwood is in the process of capturing that. I've had some conversations with the director at Northwood and about those things, and it's important that like everything we're doing with COVID-19, we're learning about the virus, and we're learning about how the impact of our response and what we can do and change as we move forward and how we need to do that better. We are going to have to take some time and space to do what in emergency response, what we call a lessons learned, where we document all these things things that we can improve and then apply them for the potential for a second wave. We're not quite there yet. We're still in the middle of the response, but as we get, hopefully, as we get out of the first wave, we'll have some time to do that lessons learned, and you know, part of that is the long-term care outbreaks, but it's only one part.
I think one of the biggest things when you say, Dr. Strang, is that when we started this 7 weeks ago, the belief was an asymptomatic person couldn't pass the virus, and we now know that that's not the case, and that's many cases that's how it's ended up in our long-term care facilities. Asymptomatic people not knowing we're bringing it in. I think the protocols around going forward would certainly make that a much greater challenge.
Yeah, it's that recognition, and that it was that growing evidence that we then moved, and once we had the appropriate supply, all frontline care providers wearing masks, and that's a big. And talking to Northwood, we're already seeing the impact of that, and that's one thing that's evidence of or an example of, as we learn new knowledge evolves and we get and evidence becomes clearer, we adapt even while we're in the middle of a response.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Premier. I have two questions for you. The first related to COVID. Newfoundland and Labrador is going to announce its plan to gradually open up tomorrow. They also today announced plans tightening border restrictions after reports of visitors going out to see icebergs, of all things. And of course, neighboring New Brunswick has also announced that they're going to prevent further influx of temporary foreign workers to assist in agriculture there. I'm just wondering, in light of those developments, are you reassessing your border measures, and in particular, I guess, in respect to temporary foreign workers?
No, working with Dr. Strang in public health, we put in strict protocols around temporary foreign workers. They will have to self-isolate like anyone else who comes into this province. As we said, at the beginning when we announced we were going to welcome them back this year, they become an important part of the agriculture and fishing industry. But we will follow the advice from Dr. Strang and his team around self-isolation, and we'll continue to do that. The same thing, though, when it comes to our border, we early on we're closing our borders down to those, the essential services obviously come in. And if you were coming in, you needed to identify where you were going, and you would have to self-isolate for that period of time. We'll continue to have those measures in place as we go through this. Dr. Strang and I continue to talk about what does the future look like, and we will watch what other provinces are doing. This virus hit Western Canada long before it hit the East Coast. We'll follow that, but our number one concern will be always the health and safety of Nova Scotians, and we will make it based on the evidence that public health sees in this province and the protocols that we can put in place to protect us going forward.
Go ahead, Keith, with your follow-up.
Yes, Premier. My second question is in light of the mass shooting, will the province tighten the wording in its Motor Vehicle Act and other legislation and ask police to review its protocols on the sale of used items? I'm talking in particular to prevent the resale of used police vehicle items like light bars and decals at public auctions and other methods.
Well, we'll look at those details as this investigation unfolds. I want to let the RCMP follow through with this investigation. I'm sure there'll be recommendations coming out of this, and not only here in Nova Scotia, but I'm sure nationally they'll be looking at how do we address the issue of surplus equipment from law enforcement agencies across the country, as well as military equipment that would be going up as surplus. But we'll look at that in conjunction with the federal government and our partners.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, the Nova Scotia Health Authority started scaling back surgical services in mid-March in order to build capacity for an expected surge of COVID-19 admissions. There's 11 people right now in hospital. Wondering why can't surgeries and other procedures be started up now?
So that is part of the discussion of moving forward as we start to talk about it's not only just slowly relaxing the public health restrictions and try to open up the economy. It's also how do we open up the rest of our healthcare system, both our hospitals and community-based providers. But again, we need to do that slowly and carefully. The last thing we want to do is open up our hospitals again, fill them up, and then realize that we have a resurgence of COVID-19. COVID-19 that now we can't handle. So the two have to go hand in hand in terms of a timing wise and feed off each other. But again, opening up the healthcare system needs to be done as slowly and carefully as we're doing other parts of our COVID response.
Go ahead, Natasha, with your follow-up.
Thank you. Dr. Strang, Nova Scotia's COVID-19 modeling projections didn't include a potential number of deaths that could occur from the pandemic. Wondering, there's been 22 Northwood residents that have died in the last 11 days. Are we going to continue to see almost daily reports of deaths at that facility?
Well, I've asked today to see how many people we know that a number of people are in that facility are very frail and fragile, and any health event can put them at greater risk of dying. So I'm waiting to hear back on who might be, the numbers that we can expect. We have to recognize that we still have active disease. Many people are still infected, is still not considered recovered yet. So until we're out of the woods and are able to say there's no longer any ongoing active illness in Northwood, given the patient population or the resident population, we have to anticipate that we might see ongoing deaths. I come back to, I need to remind the vast majority of residents who have been infected are recovering. Or can be considered recovered. And that doesn't at all mean to minimize the number of people who have died in that facility, but it is a reality of the frail, fragile population in our long-term care facilities, which again comes back to why we all need to do what we're being asked to do to minimize the chance of COVID-19 getting into a long-term care facility in the first place.
Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Hello. Premier, it's been more than a month since you announced one-time funding for income support recipients in Feed Nova Scotia. I'm wondering, will you give those folks another boost, and can you explain why or why not?
Well, we started early on when we provided that support. We were hearing from the food banks across our province that were having challenges. We were hearing from retail stores who would normally supply the food banks having challenges of putting supply in the food banks. So we provided the additional increase to have a number of our clients who would be going and availing themselves of a product that is in the grocery store. During that same period of time, we provided a substantial amount of money to Feed Nova Scotia, which would be distributed across the province. And we'll continue to watch and address that. Minister Regan has been following that. We've had a few conversations about it, but no decision has been made on that yet.
Go ahead, Shayna, with your follow-up.
Thank you. My second question is for Dr. Strang. Dr. Strang, you said we have capacity for expanded testing. You made a little reference to we're looking at how that would happen now. And I know yesterday you mentioned testing in homeless shelters. But I'm wondering what other groups would be candidates for expanded testing. How would that work?
So we haven't made any firm decisions on that. Certainly, we are in the process of now moving the testing in our homeless community into other parts of the province where we have homeless shelters as the very first step. There's a group that was meeting this morning to talk about what this may look like, whether it's enhanced testing in healthcare workers, for instance, or maybe it's another large group of employees that we could easily test as a way to kind of get a snapshot of a large group of people and just test and see who may be positive, even though they're asymptomatic. There are some substantive challenges around when you test a large numbers of asymptomatic people, as my lab colleagues keep reminding me. So we've made no final decisions yet, but we're certainly aware that we can test upwards of 1,500 people a day in our lab, and our goal will be to try to maximize that capacity in the lab in creative ways to better understand COVID-19 and how it's playing out here in the province.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Dr. Strang, yesterday the federal government released updated COVID modeling to reflect changes since April 9th. Is Nova Scotia developing an updated model? And if it is, when would that be shared?
So we continue to look at, we've had a model, but what we're doing right now is really, to be honest, we're focusing more on refining our epidemiology. So looking what we actually have. We're also doing some modeling to look at what, to support our ongoing need to have an appropriate supply of PPE. But the focus is really to understand how the disease is actually playing out here in Nova Scotia, and not so much about modeling what could be, but really understanding what is actually happening.
Go ahead, Lindsay, with your follow-up.
Yes, this is for the Premier. There are less than 7,000 nursing home beds in Nova Scotia as our senior population continues to grow. The province's nursing home projects over the last 2 years boost capacity by just 1%. Recognizing the pressures of COVID, how and when will the province come up with a strategy to build up capacity?
Well, one of the things that we heard really 7 years ago from Nova Scotians is they wanted to remain home as long as possible. That's why we've continued to invest in home care, providing supports around ensuring that people can live at home for as long as they can. And what you've seen is we've reduced the wait list for long-term care facilities. We are strategically making investments across the province. You would have seen a number of them that would have been one on the South Shore, one down in the French Shore. We've made a number of investments in Cape Breton Island where we know the demand has been. So we'll continue to assess that as we go forward. I think one of the things that I think many of us recognize that when people are going into long-term care facilities today, their health care is obviously at a point where they can no longer be at home, which means they need more support and they're frail. And we'll continue to monitor that as we go forward through this process. But I want to thank all of those out in the community who are providing care in long-term care facilities. You've heard me say it at this podium, and I've said it at every opportunity I've been able to say this at. These are not institutions. They are individual homes for our residents, and the people who work and live in them often take these residents on as family members and offer them the same love they would to their own grandparents. And I want to thank them for that, and we will continue to work with them and support them. And as Dr. Strang said, we'll assess all of the lessons learned through COVID and apply them to good public policy.
Next, we'll go to Olivier from Radio-Canada. Go ahead.
Oui, bonjour, merci. Northwood said today that some workers that came from outside the Halifax region to work in their facility are having a hard time to find a place to live short term. So I'm wondering, is the province willing to help them, and how?
Definitely. I've not heard that, but definitely we would. We've continued to, there's hotels that we can provide support in, but we would work with Northwood without question to provide the supports if someone is looking for housing or coming in to deal with the issue of COVID.
Go ahead, Olivier, with your follow-up.
Yeah, my follow-up would go to Dr. Strang. I'm wondering, since we learned that asymptomatic cases are possible, we've seen the federal government make the use of masks mandatory during air transit. So what's your stance on making non-medical masks mandatory in other public areas?
So this is actually a topic of conversation yesterday and again tomorrow. Excuse me, at the Special Advisory Committee where all the Chief Medical Officers of Health sit. We're reviewing, the Public Health Agency of Canada is reviewing the evidence. Right now we're saying that people can, if they choose, to wear a non-medical mask when they're out in public, especially when they can't be assured of maintaining a 6-foot social distance. We may go stronger on that, but it's like everything, we need to make sure that we're reviewing the evidence and make evidence-based decisions. The other thing we have to factor in is what is the supply. If we do make stronger recommendations, what is the supply of non-medical grade masks to support Canadians or Nova Scotians to follow any recommendations we might make. So it's under active discussion.
Next, we'll go to Sharon Montgomery from the Cape Breton Post. Go ahead, Sharon.
Oh, thank you, Tina. Hi, good afternoon. I have a question for Dr. Strang, please. Dr. Strang, the number of confirmed cases of COVID represented for each zone on the website includes the resolved cases. We're wondering if it would be possible to get a breakdown, the number of cases still active for each zone.
So I'll take that back, and we'll take that under consideration and see if we can add that to our online map. Then thank you for that suggestion.
Sharon, do you have a follow-up?
I do, thank you. I'd like to ask a question of the Premier, please. Premier, on April 3rd, upset Nova Scotians were not abiding with public health protocol. You delivered an incredibly emotional message asking people to stay the blazes home. And as we know, your words struck a chord across the country, resulting in everything from songs to T-shirts surfacing. I've discovered individuals, artists, businesses from as far as Vietnam, the UK, US, carrying your message, and in many cases with your photo on everything from shower curtains to coasters, purses, iPhone cases, bedding, and so on. Obviously, some of these businesses are profiting, but at the same time, more people are seeing your message, which is aimed at conquering COVID. So I was wondering if you were aware of this and what your thoughts were on your message spreading across the world.
Well, thank you, Sharon. I must tell you, I look forward to your questions every day. Often they're of Dr. Strang, and I do appreciate them each and every day. This is really, I delivered a message from Nova Scotia. This really was a message that we would hear from our grandparents, our parents, that would have delivered that message to us when we weren't paying attention, going outside or going to town or wherever we might have been going. And it is a message that resonated with a lot of people for that reason, I believe. And it also helped us deliver the message. I'm glad, quite frankly, that others have captured the spirit of what Nova Scotians were feeling at that particular moment in time. I had noticed and had seen, of course, people are sending me stuff. It became quite a bit of entertainment for the people who work with me here and friends of mine and my family who would be sending me stuff. Many of them were frightened by the shower curtain, I must have to tell you that. But the stuff around the cups and delivering the T-shirts, and we even had a business in our province actually that laid people off, brought them back, and Nova Scotian beer companies have found a way to do it, to use it to make some employment, some income for their businesses, at the same time helping us deliver what is an important public health message during this time of COVID. So I want to thank those Nova Scotians who followed that message and continue to follow that message, because in order for us to deal with this issue, it will require all of us to stay the blazes home.
Next, we'll go to Bill Martin from Six Rivers News and Radio. Go ahead, Bill.
Thank you. My question about hospital capacity was already addressed, but I'd like to make a quick comment to the Premier. On behalf of the greater community, Premier, we thank you for your commitment to build a new hospital as a replacement for the North Cumberland facility.
Thank you. Terry Farrell and I were there when Terry was the MLA for that area. I worked very hard to the commitments I make to communities to deliver on them, but this is actually one that with an overall vision towards healthcare, making sure that we have the appropriate institutions delivering the appropriate services in the communities to allow our healthcare facilities to operate. And we will continue to assess not only our small rural hospitals, but quite frankly, our regional hospitals, and how do we make sure that we have capacity not only to deal with the challenges that we're faced with today, but the ongoing delivery of healthcare services with the new technology and new way of delivering them in our communities. So thank you for recognizing that, and I look forward to that building going up. It's one of those that we're doing with a bit of a new model where we have a few overnight beds, maybe potentially where we're addressed with long-term care facilities, as well as making sure that we have primary care delivery at that facility.
Thanks, Bill. Moving along, we will go to Kyle Shaw from the Coast next. Kyle, go ahead.
Hi, thanks. For the Premier, I'm wondering if you can give an update on the Internet for Nova Scotia initiative. It was March 20th you announced another $15 million to incentivize Internet providers to speed up their projects to get high-speed Internet into rural areas. So I'm wondering how many people have received Internet by now.
I'll have to get an update on that. It's been a while since I've had an update, so I will get one and get back to you.
Do you have a follow-up, Kyle?
Yes, thanks. I'm also wondering about festivals and other major summer events. The Coast is hearing from organizers who are holding out hope for their events to be able to go forward as planned later this year. What are the chances?
That'll depend as we work through with public health over the next number of months, and it'll depend on how well people adhere to the public health protocols to ensure that we flatten the curve and begin to take control of this virus. We are testing more on a per capita basis than any other Canadian province, and there's a reason for that, because we want to capture this virus and be able to deal with it, isolate it, and have it taken out of our province. And if that means we need to continue to enforce these public health protocols for longer periods of time, we will do that. And if that impacts festivals this year, I'm sorry for that, but it is critical that all the work that we've been doing right now, it doesn't fall back because we relieve these protocols too quickly. I will continue to work with Dr. Strang on what is the best interest of all Nova Scotians and ensuring that we stay focused, quite frankly, on our health and the public health system of our province, and then trying to address any issues that may be there.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Yes, Dr. Strang, the Nova Scotia Health Authority has been sending to doctors or making available to doctors and other healthcare professionals geographic information by postal code about COVID clusters. I have that list, actually, and it includes my house, by the way. But the purpose of the cluster information is to increase screening and better protect healthcare workers. That's obvious. But in effect, residents are telling me in those zones that they're being denied doctor visits. The NSHA itself says that surgeries will be delayed until further testing goes on for residents in those districts. People are worried that they're being redlined because, frankly, a lot of these districts are the Prestons, and they're saying that they're being redlined out of healthcare. Can you speak to them about that, and also to health professional staffs who might be misinterpreting how to be using that information?
Yeah, that's a complex question. So, I mean, this was one of the challenges, and you're one of the people, Tim, who keep pressing for more local level information. And what you just described is one of the things that we've always been concerned about, that the information is released inappropriately and is used with or without the right context. So first of all, that information was provided internally within the Nova Scotia Health Authority. I'm aware that it was actually released publicly, and the fact that you have your hands on it makes it concerning that it wasn't intended for public release. I don't know the health authority is looking into that. The purpose of releasing that data was to allow frontline staff in our local hospitals, and especially at the Dartmouth General Hospital, to know if people come in from certain communities, there's a higher possibility that they may have COVID, and so they can use appropriate personal protective equipment in those patient encounters. That was the purpose of that information. It is not at all intended to label or as the term you use, redline anybody from any communities, and is certainly not at all meant to be used as a way to deny people health care. In fact, it's used for the opposite. We know that people coming from those communities may have a greater need for health care because of a potential exposure to COVID, and that information was to be used to make sure that they can be provided the care they need in the safest manner possible.
Go ahead with your follow-up, Tim.
Yeah, perhaps related. You spoke earlier in this briefing about Northwood staff being spread across a wide geographic area and coming into the facility at Northwood, possibly, if I understood you correctly, possibly bringing COVID into the facility because they come from so many diverse communities. I wonder two things, if that was sort of a backhanded reference to people from these clusters working at Northwood, but also why isn't the reverse a concern, that people who are working at Northwood may be carrying COVID back to their communities?
So first of all, it was not at all intended as a reflection on any community. My comment was simply a recognition that when you have a large facility with hundreds of staff coming from a broad range of communities throughout the HRM area and beyond, as opposed to a smaller facility in another part, a more rural part of Nova Scotia, there's a greater likelihood of that broader mix of communities that of COVID being brought into the long-term care facility. That's the only intention of my remarks. So please don't take it as a reflection on negatively on any community. The reality is we know that in long-term care facilities and our acute care facilities that there are strict infection control guidelines and personal protective equipment guidelines that are based on the type of care that's delivered and the type of facility that, if adhered to, greatly minimize the chance of a healthcare worker actually being exposed and infected. So the real risk in long-term care or even in hospitals is people coming into the facility who now we know about asymptomatic spread, and that's one of the reasons why we've been able to move on masking all frontline healthcare providers. There's a much lower risk of taking introduction into a community from a healthcare worker from a facility.
That's all the time we have for questions. Go ahead, Premier.
Thank you, Tina. For nearly 7 weeks now, Dr. Strang and I have been here almost every day to provide you with the latest information on COVID-19 and how we are dealing with this deadly virus. We're going to change our schedule going forward. We'll be holding briefings on Tuesdays, Wednesdays, and Thursdays. Tuesday, Wednesdays, and Fridays, barring any major news. Our briefings will continue to focus how we are dealing with COVID-19. But that does not mean that we are not thinking about the families who lost a loved one in the tragedy more than a week ago. Our hearts are with you, and we think about you every day. That's why we still have the heart behind us with our tartan around it. Some of you may have noticed flags at our provincial buildings remain at half-mast, and they will continue there until sunset of May 11th. That will mark 22 days from the day we lowered those. A small gesture to remember the 22 people who lost their lives. If you see a flag lowered, it's okay to pause and take a moment. If you have a flag, it's okay to lower it. This is another way for us to honor those who died and let the families know that we are always thinking of them.